Well, hello and good evening and welcome to From Doctor to Pharmacy, Portuguese Language and Culture with our beloved teacher, Filomena Pascoal, who's here with us to take us through that. Whether you're already living in Portugal or still in the planning stages, it's never too early to start learning some essential Portuguese for everyday situations. That's what we're doing tonight. Medical appointments and collecting prescriptions can feel daunting because you're a bit stressed already potentially, especially if you're not confident in the language as well. But a few useful expressions and some cultural understanding can go a long way, and that's exactly what Filomena is here to help us with this evening. Olá, boa noite, Filomena, tudo bem?
Olá, olá, boa tarde, tudo bem?
Did I say boa noite again? I did, didn't I?
You
It just
did.
feels like it's been a long winter, a long cold
Because
rainy winter, and it's a boa noite.
because you've had your dinner, but I haven't had my dinner yet.
Okay, well we better get on with it then. So, good to see you. Good to see you. We've done the one where we go to the restaurant and get dinner. We're off to the doctors and the pharmacy this evening.
Yes, yes, we are, and we are going to learn a lot of Portuguese vocabulary today.
Great, excellent. Okay, so pens and paper or your tablets or whatever, however you take notes,
and
please be ready with those because as Philomena
and
says, lots
ready
to
to
write
repeat,
down.
repeat, repeat, repeat.
Yes, and you are watching, aren't you? You do see if everybody's lips are moving or not
Yeah.
in the gallery there. So make sure you are repeating. Philomena can see.
Yeah. So, when you want to start,
Feel free.
it's
Yes, you should be
yeah.
able to put your presentation on the screen.
Okay, so
How is Central Portugal, by the way, Miranda de Corvo? Have you got that bus yet? Or the train or the tram or whatever it is? Is it still?
oh, don't even mention
Okay, let's move
that.
on.
No,
Sorry, sorry.
because you know it was supposed to start in June,
I think
right?
it's June, Philomena.
Well, they don't think it's June. They said that probably it will start to the end of the year. So probably June for them is the end of the year. Okay.
Oh, okay. All right. That's a bit of Portuguese we won't be learning.
Yeah, but so now, yeah, no June. It's just maybe at the end of the year. But we have been like this for 15 years, so actually, I
Yeah.
don't believe until I see it. So, as I
Yeah,
said before.
fingers crossed. I'll stop asking.
Yes, because otherwise you keep asking,
Wait,
and in the next 10 years you'll keep asking, and
I'll let you tell me, okay? I won't mention it.
yeah, it's better, it's better. Okay, so healthcare in Portugal, right? Cuidados de saúde em Portugal. Cuidados de saúde em Portugal. And so we are speaking about the S.N.S, Serviço Nacional de Saúde, Serviço Nacional de Saúde. Then subsystems de saúde, because there are some agreements with the National Health Center, and also there are some health care. There is some health care that is specifically to one job, for example, the police force, for example, or the state, the social service employees, or the teachers, or they also have another system a bit different from the general National Health Service. Then clínicas e hospitais privados, so private clinics and private hospitals. Okay? So, starting with the Serviço Nacional de Saúde, this National Health Service was created in 1979 by António Arnaud, Ministro dos Assuntos Sociais, so he was Minister for Social Affairs. And so since 1979, we have this S.N.S that covers all country. Of course, it's a national health service, so all over the country, including the islands, because the islands are also part of the country. And how many islands do we have?
Oh,
Uh-oh.
I can't remember how many Azorian islands. I mean, is the question how many autonomous regions, as in the sort of
No, 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 no.
total of
How
islands?
many islands? Because we have Azores and we
Yes.
have Madeira, right?
Okay. Let's not answer that right. Let's leave that hanging
Let's
there.
see, how many
Yes, that's a
islands
great question.
belong to Portugal? Okay.
Okay. I've never heard that question before. It's a great question. So yes, you're not allowed
Yes.
to use Google. You've got to go and get your encyclopedia or your atlas for this one.
Yeah. So all over the country, as I said, you have the National Health Service, of course, and it's universal. It's a universal service, which means it's for everyone, and a general service. So health promotion, diagnosis, treatment. So it's not just uh, going to the doctor, but for example, they release information about how to prevent this or that in terms of health, or for example, the blood donors and things like that. So they have some campaigns sometimes to inform people what they should do. It's free of charge, so it's a service that you don't pay to see a doctor, for example. And it's divided into 5 regions. So, Administração Regional de Saúde is each one of the regional health territory, and it's one in the norte, the other in the center, centro, Lisboa e Val do Tejo, because of course there are lots of inhabitants in Lisbon and Tejo, the Tagus Valley, compared to the rest of the country, and Alentejo, Algarve. So the 5 regions in the mainland are those: Norte, Centro, Lisboa e Val do Tejo, Alentejo, Algarve. Then, speaking about subsystems de saúde, there are the public systems of health, so literally subsystems of health. The social service, the funcionários públicos, they have something called ADSE, assistência à saúde dos trabalhadores do Estado, e militares das Forças Armadas, so for example, the militaries, the army, the PSP, the police force, Polícia de Segurança Pública, the GNR, the other police force. And by the way, the difference between the PSP and the GNR is the PSP is a police force in cities, and the GNR is the police force in villages and towns. Okay, so the PSP is always in bigger areas in terms of with more population, right? Cities. And if it's a village or a town, then it's under this GNR, Guarda Nacional Republicana. So, as I said, these are specific jobs that have this subsistema de saúde. So, in the monthly income, they have a discount. They deduct a part of the income to this, like an insurance. It works as if it was a health insurance. So they pay this every month, and then they can go to the doctor, for example, in a private hospital, and pay a lot less than the the usual. It works a bit like an insurance. Then privados, the private ones. You have, for example, bancários, Portugal Telecom, bancários, the bank clerks, Portugal Telecom. So they also have private systems of private health systems, and so it's just, for example, with the certain hospitals and things like that. So, clínicas e hospitais privados. You can, of course, go to the private clinic or a private hospital. Any private hospital is available to anyone who wants to pay for the doctor appointment, for example, or surgery or whatever you need. But you can also have a private health insurance, seguro de saúde privado, which is becoming more and more common in Portugal. So you have several insurances, like for example, multi-care, advanced care, Medis, Medicare, etc. So lots of insurance in the market, and so you can compare and decide for one of the insurances. Then convenções com o Estado. There are some agreements with the state, and so, for example, I can go to what we say, the family doctor, médico de família, from the National Health Service. And if the doctor prescribes something like an X-ray or something that I need to do, an exam that I need to do, I can go with the prescription from the family doctor. I can go to the private hospital and I don't pay anything because I have that prescription from the National Health Service. So this is the agreement that some hospitals have. And so you can just ask if there is any agreement. They usually have a poster or something with the agreements that they have. And so you can, for example, do the exam, the X-ray or whatever it is, or with the prescription from your doctor from the National Health Service. Then, of course, the private hospitals, as I said, you can go and just book an appointment and pay. Usually, a doctor appointment usually costs about 70 euros, 80 euros, 90. It's more or less the price for one appointment. So you have, for example, the big groups that are working in Portugal as private hospitals are, for example, Luz Saúde, Hospital de Luz, or CUF, or Lusíadas Saúde, more in the area of Lisbon. So you have the big hospitals that are spread all over the country. So back to the National Health Service, Serviço Nacional de Saúde. You have from the smallest health center, Centro de Saúde. So the Centro de Saúde is where you register when you become a resident in Portugal. You can go to your local Centro de Saúde and you can tell them that you would like to register in the Centro de Saúde. You can register and you can if there is availability, you can have a family doctor. If there isn't, you don't have a family doctor, but of course, if you need an appointment, any doctor from that health center can see you. If you have a family doctor, then you are seen all the time by the same doctor. So it's easier in terms of following your health. Then, of course, you also have hospital, the hospital. Like, for example, here we have Hospital da Universidade de Coimbra. So it's a huge hospital in terms of the country. It's an important one because it's a university hospital, which means the experts are there. And sometimes people come from all over the country, not sometimes, but every day. They come from all over the country because the experts are here and they have to be examined or treated here in Coimbra. And sometimes when there are some accidents and people have to come by helicopter and things like that, they are also transported to the hospital of Coimbra. Of course, it's the biggest in the area. Then you also have this S.N.S 24, S.N.S 24, which is the telephone that you can use in case you are not feeling well, but not in case of an emergency. But if you don't know what to do, you have got some temperature, or you are feeling sick in general and you don't know what to do, instead of going to the hospital, you can dial this 0808 24 24 24, and then you can ask they are going, of course, to ask you what the symptoms are, and then they are going to advise you what to do. If they consider that you should be seen by a doctor, then they also send within the system, they send a notice to the nearest hospital or to the nearest health center. And when you get there, they already know what the matter is. So it's also a way to get sometimes a quicker entrance into the hospital, because you have already called before, and so they know what the problem is. You also have the site where you can get information about the National Health Service, so the www.sns24.gov.pt. You have the app, like nowadays, lots of apps, and so you also have S.N.S 24, and Utente is the user of the National Health Service, and you get a number when you register at your local health center. You will get a number that is called the Número de Utente. Sometimes, if you already have the UTENT number when you get your card for residence, the UTENT number is also there on the card. And so this is a number that you use to, for example, to use the app. So you enter your number and then you can use the app. Then to call an emergency number, which is the INEM, Instituto Nacional de Emergência Médica, it's the 112. So 112 is a number that you should dial, but just when it's an emergency, because this is a very, very important number to call if you are in an emergency situation. But please don't call if it's not really an emergency. So if it's something that you would like to ask, you just call 808 24 24 24. Otherwise, if you need an ambulance, if you need a doctor urgently, then you should call 112. I know that some people say that if they don't speak Portuguese, they are not, sometimes there isn't anyone who can speak English. It is a fact that can happen. But at least if you can say some keywords, for example, your location, where you are, or something like that, at least that. And of course, you should learn a few sentences as well, in case you need to call the 112 and if they don't answer in English. But nowadays, in my opinion, I think nowadays it's easier to get someone to speak in English, but you never know, because we are in Portugal. Portuguese is the official language, and so it's a fact that although they should also answer in English, but I think they still just have the Portuguese option. So about the Centro de Saúde. As I said, you can go and ask for your número de utente, your user's name, let's say. And I have this in English and in Portuguese as a resident in Portugal. This was more for the British, because I usually work with the British a lot more. But as a resident in Portugal, you have the right to access state healthcare on the same basis as Portuguese citizens. And so I'm going to read the Portuguese part, because the other one you can read it yourself. So in Portuguese, you have on the right, traga o seu passaporte e documento de direito de residência. So usually you already have the card. Then não precisa de número de segurança social. Some people think that they need a social security number, but at least until a while ago, I don't know now, but I think you don't need a social security number to register at the health center. Then it's se recebe uma reforma do governo britânico, peça NHS Overseas Healthcare, time formulário S1 e registre-o num Centro Distrital de Segurança Social em Portugal. So that is for retired people from the UK, and they know that they have this form S1 to register. Then apresenta uma cópia do formulário S1 no centro de saúde no qual se está a inscrever, so you can take that form with you to the health center and register. Não se registra ou tenta utilizar os serviços de saúde com o seu cartão europeu de saúde de doença se é residente em Portugal. There is a card, especially for Europeans. I'm speaking, what I know is the Europeans. I'm sorry, I'm not very used to working with Americans yet. But in Europe, we have a card, a blue card, that is valid all over Europe. If you are a tourist, okay, not for residents. So if you are a tourist and, for example, I go to France or to Germany, and if I need to go to the doctor, I have this blue card, this cartão europeu de seguro de doença, so the European card of health insurance, that is valid everywhere in Europe. And so I can present that card, and that card identifies me as a Portuguese citizen and all my data, you know, the number from Portugal, you know, the user number and everything. So you can also, of course, access the Portuguese national health system. But even if you are an European and have this blue card, if you are a resident, you shouldn't use this blue card, because this blue card is just for tourists. Then, how can you say that you would like to register? You could say, queria pedir o número de utente, por favor. So this is, I would like to ask, to request the, to request the user's name. So you can say at the counter, queria pedir o número de utente, por favor. That's how you request to register as a patient in your local centro de saúde. So, queria pedir o número de utente, por favor. Okay? So, when you go to the local health center, you usually have a machine to take your turn, your ticket. And so in the machine, you have a screen, for example, with options like this. The first option here, confirmação de consultas ou atos de saúde, is just to check an appointment, a doctor appointment, or any appointment with a nurse, for example. Marcação de consultas ou tratamento, vacinas, is when you want to set an appointment. You don't have it yet, but you want to set an appointment with a doctor or with a nurse for any treatment, for example, that you need after a surgery, for example, to take the stitches or whatever you need, or to take a vaccine. Pedido de nova inscrição. This is the request for a new register. So this is, for example, on this screen, this was the right key to press if you wanted to request to register. Then receituário, that is the prescription. So if you need a prescription for some medication that you already are taking, you would press this button, receituário. And then outros assuntos, if it's not covered in these options, other matters. So outros assuntos. Declaração de presença, you probably won't need it, but if you are a worker, you can ask, for example, you went to the doctor and you missed your day at work. And so if you didn't go to work, you can ask for this declaration of presence. So they are going to say, write on a declaration, a form, they are going to say that you were at the health center from, for example, 9 o'clock in the morning until 10:30 in the morning. And so with that, you can present that to your boss at your job to justify why you didn't go. So then when you take a ticket like this, you usually have a screen in the waiting room. So you take the ticket, you go to the waiting room, and then in the waiting room, you usually have a screen a bit like this. So they are going to call you, and also you can see that on the screen. So it's easy to follow, even if you don't know the numbers. We are going to see the numbers, but even if you don't know the numbers, it's easy to follow because every time they call, the information pops up there. So if you have, for example, B for prescription, B, it was prescription, receituário. So for B, it was ticket number 20 and the counter number 4. So then you have the M and the D and the B's for the different tickets that are that can be taken. Okay. So to take a ticket in that sense of your turn, you can say tirar uma senha. Tirar uma senha. So that is to take a turn ticket. Marcar uma consulta. Marcar uma consulta is to set an appointment. Marcar uma consulta. Set a doctor appointment. Marcar tratamento is to set a treatment, something that you have to take care with the nurse usually. So marcar tratamento. Pedir uma receita, to ask for a prescription. Pedir uma receita. So tirar uma senha, marcar uma consulta, marcar tratamento, pedir uma receita. Or you can also levantar uma receita. So if you go and ask for a prescription, of course, it's not going to be an immediate prescription is not going to be written. And so your doctor or a doctor from the health center has to pass the prescription, write the prescription, and then later on you can go and pick it up. But nowadays they also send you, if you have a Portuguese number, a Portuguese phone number, they also they can send you to your phone, and you just need to present the text that you get from the National Health Service in the pharmacy. You just present that on your phone, and in the system everything is in the system, and they can easily access to the prescription from your doctor. But if you want a paper one, you have to go back when they say, okay, in 2 days or next week, you can come back and pick it up. So you go and pick it up. So levantar uma receita is to pick up a prescription. So as I said that, because they are calling the numbers, this is also an opportunity to learn the numbers in Portuguese. So números, numbers. And remember that the M, as I always say, the M...
Nasalate.
Nasalate, that's right, nasalate. So you don't read the M, it's just the nasal sound, right? The U is nasal, so And then dois, the S at the end, sh. So dois. Very good, Pedro. Very Três. Again, the sh at the end. Três. Quatro. The O at the end. Always the sound U, like a double O in English. U. Quatro. Cinco. Seis. The EI, that sometimes English-speaking people have a little of difficulty in pronouncing the EI together, is the sound A. It's exactly like an A and a Y in English. So in the word they or pray, or so other words with A, Y. It's exactly the same sound. The EI is A. So seis. Then sete. And about sete, sometimes people think that the last E is not pronounced. It is pronounced, but our last E is The sound is just so that's why it doesn't seem to be pronounced, but it is sete, sete. Then oito, nove, again the sound nove, dash. So the Z at the end works the same as the S at the end, the sh sound. So dash, onze, doze, treze, 14, 15, 16, 17, 18, 19, 20. So now I'm going through them quicker. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. I hope you repeat it with me.
Filomena, can I add something here?
Yes.
I wasn't at the doctor. Excuse me. I wasn't
Oh,
at the
you need to go to the doctor, Carl.
No, I'm gonna. Yeah, my doctor for this is Dr. Bayard. Okay,
Uh-huh. Okay, okay.
but I went to book a barber's appointment. Yes, Jerry, it doesn't take very long once I'm in there. But she said to me, 13 mail. Now, I get really panicky when it's 13.
E meia, 3:30.
13 Maya, like, and I'm thinking, is that 3.5 or 13.5 on the 24-hour clock? So
Okay.
that's a tricky one, isn't it?
No.
No, it's not a tricky one at all.
I'll tell you why.
Okay,
Because in Portuguese, you never use the word meia
yeah.
after 12. Okay?
Is
Never.
that right? I didn't
Yes.
know that.
So you can just use 8:30, 9:30, 10:30, but never 13:30 or 14:30, not 30, sorry, half, okay?
Okay, that's
Not
helpful.
30, half, meia. The
Yeah.
word meia, I'm sorry if I said 30. The word meia is never used with 13 or 14 or 16 or 20 or
Okay.
23.
All right. Good.
Never
So,
with the
yes.
word meia, okay? It's
Okay.
always 30. You say, for example, 13:30.
Okay.
13:30. 13 and 30. You
Right.
would never say 13:30. That's wrong, okay?
Okay.
So
Good. Good to know.
that's why I said it's not tricky because it can't
It's not
be
anymore. It's not
it
anymore.
can't
Thank
be
you for that.
13
That's right.
and a half, okay?
But this
It's
could be useful at the doctor, of course, couldn't it? Because
Of
if you get
course, yes. For the appointment time, yes.
Mm.
But they can tell you, for example, 14:30,
Mhm.
14 and 30, so
Mhm.
2:30, but 14:30, or they can say 2:30. And duas, why not dois? Because we are speaking about horas,
Yeah.
and horas is a feminine word. So 2:30. You can say 2:30 or 2:30. That is possible. Both are possible. But after 12, you never say meia. Okay?
Fantastic. Thank you for that. There you go. I never have to have a problem again with that. Like,
No,
was it
never again.
1:30 or was it 1:30 on a 24-hour clock or 3:30? So I wrote it down and so she's like, yes, you idiot. 3:30. Goodness. See you tomorrow. Goodbye.
Yes, okay. Now you know. After 12, never Maya. It's always 30. So if they say Maya, it must be before 12. Okay. Or
Fantastic.
at least the one, two, the number one or two or three or four
Yeah.
until 11. Okay.
Very good.
Then after 20, you add 20 and 1, right? So 21, you say 20 and 1. Of course, if you read everything like it is written there, 21, you read everything like that. 21. But do you think the Portuguese speak that slow? No. So you don't hear 21. You say 21, right? 21. And you just link everything together and say 21, 22, 23, 24, 25, etc. Right? So you keep adding. Then you have 30, 40, 50, 60, 70, and those are tricky because they are very, very similar, right? 60 and 70, 80, 90, 100. So 20, 30, 40, 50, 60, 70, 80, 90, 100. The word 100 is just for 100. Just 100. Because if it's 101 or 120, no matter what, if it's over 100, it's always cento. So, for example, 101, 101, 101, 101, 102, 103, etc. Okay? Then we can see the hundreds. So, 200, 300, 400, 500, 600, 700, 800, 900, 1000. 200, 300, 400, 500, 600, 700, 800, 900, 1000. 1001, etc. Then, for example, even in a year, even if this is a year, 1049, for example, you would say 1049, but we never do. So we always say 1049. So we say 1049. For example, 1100. 1100, we say 1100. 1100. For example, 1180, because it's 180. So it's no longer saying, it's a 180. Okay? So this, let me see if, okay. I was trying to see because now I can. Okay. 1950, for example, for the year. You don't say 1950 in Portuguese. We don't say 1950. We say 1950. Okay? So, vocabulário. Some vocabulary. Consulta is doctor's appointment. So even if you want an appointment, for example, at the hairdresser, it's not consulta, okay? That is just uma marcação. Fazer uma marcação is to set an appointment at the hairdresser, for example. But consulta is with a doctor. Tratamento, treatment. Balcão, for the counter. Gabinete ou sala, it can be the nurse's or the doctor's office. Receituário ou receita for prescription. Sala de espera and quicker. Sala de espera, waiting room, sala de espera. Médico, if it's a man. Médica, if it's a doctor, a female doctor, a woman. Enfermeiro, if it's a man, and enfermeira, if it's a woman, for nurse. Funcionário ou recepcionista, employee or receptionist. Sintomas, for symptoms. Febre, so it's not fever, but it's any temperature is febre. Tosse, for cough. Constipação, it's cold, okay? A cold. If you get a cold, it's constipação. Then, dor de cabeça. Dor de cabeça. Garganta inflamada. Garganta inflamada. Gripe. The I is the sound E, not I like in English. So, gripe. Dor nas costas. Dor de barriga. Barriga is literally belly. So, but you can say dor de estômago or dor de barriga. coração, peito, again the sound EI, A, so peito, braço, the C with the cedilha underneath is the sound S, braço, perna, mão, dedo, and the dedo can be a finger or a toe. If it's a toe, dedo do pé, right? Dedo do pé. It's the finger of the foot. Pressão arterial. So I'm going to read quicker. Consulta, tratamento, balcão, gabinete, sala, receituário, receita, sala de espera, médico, médica, enfermeiro, enfermeira, funcionário, recepcionista, sintomas, febre, tosse, constipação, dor de cabeça, garganta inflamada, gripe, dor nas costas, dor de barriga, coração, peito, braço, perna, mão, dedo, dedo do pé, pressão arterial. Then at the counter, ao balcão, you can say, queria marcar uma consulta. I would like to set an appointment. Queria marcar uma consulta. Or, preciso de pedir check-up geral. We say check-up, okay? I need to ask for a general check-up. So, preciso de pedir check-up geral. Tenho uma consulta marcada. If you have already the appointment, you can say, I have an appointment. Tenho uma consulta marcada, so it's already set. Preciso de uma receita deste medicamento. Preciso de uma receita deste medicamento. I need a prescription of this medication. Venho levantar a receita que pedi ao médico de família ou à médica de família. So I come to pick up the prescription that I asked to the family doctor. So male ao médico, female à médica de família. Venho entregar os exames ao médico ou ao meu médico. I come to hand in the exams to my doctor. So again, if it's a man, ao meu médico. If it's a woman, à minha médica, if the doctor is a woman. So I can go through them again quicker. Queria marcar uma consulta. Preciso de pedir check-up geral. Tenho uma consulta marcada. Preciso de uma receita deste medicamento. Venho levantar a receita que pedi ao médico de família. Venho entregar os exames ao meu médico. Of course, for example, for you to hand in the results of an exam, if your doctor prescribes the exam and then you need to go and hand in the exams, you can also use the email that they usually have an email that you can use, or even on the app and on the online S.N.S, you can also upload the exam and give it in. No consultório, at the doctor's office, you say, sinto-me mal, I feel badly, so sinto-me mal. Estou constipado. Nothing to do with constipation, but I've got a cold, so estou constipado. Tenho tosse ou estou com tosse. I've got a cough, so tenho tosse. I have a cough. Or estou com tosse. Literally, I am with a cough, but you can say I have or I am with, and this structure is the same. Tenho febre ou estou com febre. I've got a temperature. Tenho febre ou estou com febre. Tenho dor de cabeça, or you can say in the plural, tenho dores de cabeça. I've got a headache, or I have lots of headaches. But in Portuguese it can be plural as well. Dói-me a garganta, so my throat aches. Dói-me a garganta. If it's something in the plural, you can say dói-me in the plural, the verb in the plural. Dói-me as pernas, so my legs ache, but my legs plural, so dói-me. Cortei dedo, I've cut a finger, or queimei dedo, I've burnt a finger. Parti braço, well, that is obvious. It's a more obvious situation. I've broken an arm. Okay? So, sinto-me mal, estou constipado, tenho tosse, estou com tosse, tenho febre, estou com febre, tenho dor de cabeça, dói-me a garganta, dói-me as pernas, cortei dedo, queimei dedo, parti braço. Then you go to the pharmacy. So in the pharmacy, you have the vocabulary receita, farmacêutico, medicamento, antibiótico, comprimidos, cápsulas, xarope, supositório, pomada, gotas, penso rápido, de 8 em 8 horas. For example, if you have to take the medication every 8 hours, this structure in Portuguese is de 8 em 8. So you repeat the number and you say from 8 in 8, literally. So de 8 em 8 horas. That means every 8 hours. So for example, if it's every 12 hours, it would be de 12 em 12 horas. About the exams, what exams can you do? Analysis or analysis ao sangue. Jejum, sometimes you have to fast before an exam. And so it's very, very important that you understand the word jejum because you can't eat anything. Análise à urina, for example, análise à urina. Eletrocardiograma, ecocardiograma, colonoscopia, raio-x, so that's the letter X in Portuguese, X, raio-x, TAC, so it's a CAT scan, but TAC, it's the other way around, as usual in English, CAT, and in Portuguese, TAC. Ressonância magnética, mamografia, espirometria, Holter 24 horas. So these are some exams that you can take, okay? And so, yeah. So this is
Wow.
What I have prepared for tonight. I don't know if you want to ask anything. So that's it, okay?
Superb. I think people can feel prepared now going to the doctor and the farmacia, not pharmacia as I used to say.
Not pharmacy. No, not pharmacia. Farmácia because you have the accent on the second A, right? It's farmácia. And the accent always tells you that where the accent is, you stress that syllable. So unlike the other words that finish with ia, because when you split a word like, for example, padaria, you say pa, da, ri, a. So the one before the last syllable is ri, R-I. So you stress that I, padaria. So you have lots of words like sapataria, padaria, pastelaria, gelataria, tabacaria. So many shops
We should
are
make a song.
with...
We should make a song. That sounds that would lend itself very well. Jerry on guitar.
But farmácia has the accent. So not farmacia, but farmácia.
Yeah, farmácia. Okay, thank you so much. Muito obrigado, Filomena. Excellent. Do we have any questions for Filomena from the presentation there? I think people will feel well prepared and some interesting things. I love foot fingers. I mean, foot fingers.
Yes, the
Is
foot
a lovely
fingers, yes.
little detail of Portuguese, isn't it? Thank you, Filomena, says Diana. As always, your lessons are always both educational and entertaining. I especially appreciate learning proper Portuguese elocution. Can you please enunciate the difference between the two words meo and meo? That's if I've got them right there, Filomena. And is it Mayo, the phone company? I don't
Meo
know.
with a MEO is the phone company.
Right, yeah.
So it's just the name of the company, nothing else. But
Oh, no.
MEU means my if the word that comes next is a masculine, okay? It's a masculine word. It doesn't depend on the person, but it depends on the thing that is yours, right? So if it's, for example, your car, it's a carro is a masculine word. So you say o meu carro, my car. But if it's your house, casa is a feminine word. So you say a minha casa.
Okay.
So meu is my in the masculine form because the feminine is minha.
Great. Debbie in support there. Also saying great lesson, obrigada. Or meu cão or minha cadela. So there you go. And Mayo is only the phone company. That's just a uniquely commercial thing, right? There's no Portuguese word.
No, no. Mel is just the name of the company, nothing else.
Okay. George, thank you. And a visit. George very brilliantly pointed out that we know the General Pereira because we met him in a way, didn't we, at Batalha? And George has been over to the battleground of a different battle, not Batalha, but a different one over in the Alentejo, which you might tell us about in a little while, George. But you got a question here, which is, "O meu caro e a minha viatura."
No,
What is the
not
difference?
Mea. No, Mea doesn't exist. No.
Oh, interesting. Okay.
No, no. O meu carro e a minha, as I have presented on the PowerPoint, minha, MINH for the sound n, and an A. So minha.
So we've
Mea
got that.
doesn't exist, okay? O
Right.
meu carro e a minha viatura. And the question is, what is the difference between carro and the viatura? Well, the same difference as in English, a car and a vehicle, right?
Very good. Yes. Okay. Well, we'll say thank you to you for the time being for those who are watching on YouTube. So our YouTube viewers, if you want to stick around after these recordings, become an Expats Portugal member, sign up at expatsportugal.com. So thank you very much.